The time is 1:01. I'm not alone here. I am with Mrs. Carol Massyn. Hello, Mrs. Carol.
Hello, nice to meet you, Ria.
How are you doing, though?
I'm doing well, a little bit out of my comfort zone, but I'm well.
Thank you so much for accepting our invitation. We understand you're very busy, but you are able to make time for us. We truly appreciate that. We are eager to learn about your field.
Only a pleasure.
Thank you so much. All right, let us read the bio of Mrs. Carol. Carol is a qualified cytogeneticist and head of the Cytogenetics Laboratory at Pathcare Pathology Laboratory. She became involved in the Paediatric Genetic Clinic at Dora Nginza Hospital when analyzing the blood samples of babies with Down syndrome. Through that, she became involved with PEDSA, which offers support to families of newly diagnosed babies and ongoing support with schooling, information, and awareness drives. She is currently a chairperson of the Port Elizabeth branch and has been for the past 5 years. This is amazing. So can you please just tell us, this word is so big, cytogenetics. Just please tell us about that. What is that to someone who is listening, and what do you do there?
Okay, Ria. So cytogenetics is one of the fields of pathology. So the different disciplines in pathology align with the different body types or body cells that you are analyzing. So for example, if you are studying blood disease, you would be doing hematology.
Wow.
If you are studying tissue and cells, you would be doing histology or cytology. So cytogenetics is the study of the chromosomes / the DNA in our body cells. So in a nutshell, my field is the chromosomal analysis of various tissue types. So the next question is, people say, well, why would you be referred for that? So you are referred in different stages of your life. Doctors could refer you for these tests. For example, the first stage would be even before the baby's born. And this is known as prenatal chromosome analysis. So, for example, if the mum is of advanced maternal age, or she's got a family history of problems, they might be referred for chromosomal analysis. There's different ways you can do that. The technology is changing rapidly. It's going what we call the molecular testing. You've heard of PCR. It's moving in that way. And then you have standard cytogenetics. So at the end of the day, you want to see, has that baby got a normal number of chromosomes? So the normal number is 46. So, for example, you and I are 46XX because we are females. The males will be 46XY. And then you have a whole range of different numerical or structural abnormalities that are possible to the correct number of 46.
Wow.
And that's where the analysis comes in. So the first stage is prenatally. The second would be when a baby's born and the doctor might suspect that things are not as they should be. Or in the first few months of the baby's life when the baby's not following the correct milestones, okay, mentally or physically. They might then do genetic testing, which can be a whole different array of types of genetic testing. The next type would then be school-going age. Again, the child's not developing as they should. A teenage puberty, when on the sexual side the child is not developing as they should. And then you get the other spectrum where the couple is battling to fall pregnant, and infertility issues could be due to genetic problems. So one can be referred all along the way, looking for various chromosomal abnormalities. So Down syndrome is just one of those abnormalities. So Down syndrome is the most common
Oh.
genetic abnormality, which most common chromosomal genetic abnormality, which we can detect.
All right, so once you've detected a problem in a person, be it they can't fall pregnant, be it they having a chromosome problem, how do you solve or do you manage? What is it that you actually do when you encounter situations like that?
Okay, so we are in most instances not directly related to the patient. The result goes to the doctor. So let's talk about prenatally. Let's start off there. So if a mother gets the result or the diagnosis that her baby has, for example, got Down syndrome, the laboratory nor the doctor makes the decision for her. It's her decision if she's going to terminate the pregnancy, she's going to continue with the pregnancy. Not every mother that has the test done has already made the decision if they're going to terminate the pregnancy. Many instances, they just want to be prepared. So you can have testing done, and if it is abnormal, which by far the majority is normal, but if it is abnormal, then the mother gets advice from her doctor. She can make the decision. Sometimes the patients are referred to us, so they want to see the result. They want to understand how it's happened. Then we can explain it to them. At a later stage, if it's a child, for example, or an adult, the results go to the doctor. With the Down syndrome, once the family's got the result and the mom has received the result, and this is how I got involved, because at that time we were assisting with the Paediatric Genetic clinic at Dora Nginza, and you realize that these moms were getting the result, but there was no follow-up support once they got home, once they were home with the children. And that is where there are many associations that offer support for various conditions. So the Port Elizabeth Down Syndrome Association is affiliated to the national body, which is Down Syndrome South Africa, DSSA. So we're a branch, and there are, I think, 7 branches throughout the country in the major cities. And most of them are led by either professionals in the laboratory setting, or maybe a pediatrician, or some branches are actually from mothers themselves of a child with Down syndrome who has become well informed, and they can then assist others.
So what really causes a mess up in the chromosomes that leads to situations such as these? Because you mentioned quite a few of them, but what is the cause?
Okay, so they differ. So Down syndrome is what we call a numerical chromosomal abnormality. There's a problem in the number. So with Down syndrome, you have an extra chromosome. So they have got 47 chromosomes instead of 46. And the extra chromosome is the number 21 chromosome. And that is why Down syndrome is often referred to as trisomy 21. Because instead of having 2 copies, you have got 3 copies of the number 21 chromosome. And why does it happen? In most instances, it is a random event. It's a random event at conception. Okay, so at conception, the mother in the mother's egg would pass on 23 pieces of DNA or chromosomes, and the father would pass on 23 pieces of DNA or chromosomes. But sometimes there's a term we call non-disjunction, where in the production of those eggs or the sperm, the body made an error. We made an error in that cell division. And instead of passing on 23, the body passed on 24. Okay, so then you would get 24 from either mother or father, 23 from the other partner, which equals 47. There's your extra one. if the extra chromosome is a number 21 chromosome, the outcome is Down syndrome. If it's an extra number 18 or a number 13 chromosome, the outcome is different. I normally liken it to a recipe book. So each gene in our body, and we've got thousands of genes, is like a recipe book for our muscles, our heart, our brain. So if there's an error in that recipe, either too much or too little, the outcome is tweaked. Okay, so in a Down syndrome, that is why the children all have similar problems, because the recipe has been changed in a similar way. They all have an extra number 21. But what is interesting in Down syndrome is that although all the children may have an extra number 21, the outcome may be mild or the outcome may be severe. And that we don't know, we can't predict as to a baby is born and they are diagnosed with Down syndrome, but we cannot see from a laboratory aspect if that's going to be a mild case or a severe case. An indication of a severe case is that 50% of babies with Down syndrome have a cardiac defect. And generally speaking, those with a cardiac defect will be slightly more severely affected than those babies who do not have a cardiac defect. But it varies. There's a huge variation in the outcome.
Wow. So what did you study to become this?
The course has changed a lot over the years. I studied it many years ago. So when I studied it, you actually did medical technology. It was offered here at NMU, which was in those days still called Port Elizabeth Technikon.
Yeah.
And which is now NMU. Yeah. And along the way, the course has changed. So you studied medical technology, and then you specialized in different electives or different disciplines. As I said right in the beginning, hematology, histology, cytology. I actually first studied cytology, which was the malignancy, and then I changed over along the way to cytogenetics. So currently it's now a full degree course at NMU. It's offered at 6 universities of technology in the country. It's a 4-year degree and very similar structure with added subjects because the technology has changed.
Yeah.
A lot of molecular pathology is now added, and that type of technology has been included because across the disciplines molecular pathology has crept in.
How important is this field that you are in our country?
We often call it the hidden profession because no doctor can successfully diagnose a patient without doing laboratory testing.
Oh, wow.
Okay, so whether you are in hospital or you have seen the doctor in his rooms, let's take a common condition like diabetes. A doctor cannot diagnose you definitively with diabetes before he's done your glucose, fasting glucose, and a whole array of HbA1c testing now. He might have clinical symptoms, which it is suggestive of diabetes, but it will be diagnosed by a laboratory test.
You admit it.
Yeah. So, but we're kind of the field between the patient and the doctor. So in many instances, as I say, people call it the hidden profession because you're not always seen by the patient.
Okay, so how scarce is it? How scarce are you guys? Do you still need more people to take a look at this career and pursue it, or are you just fine?
In many of the electives, there is a scarce skill. There is a scarce skill. It's rapidly changing. It's rapidly changing into the molecular field, but the need is still there. The need will always be there, because as I've said, the doctor or the hospital cannot diagnose the patient without tests daily. How those tests are performed, the testing platforms are changing. Years gone back, many of the tests were done by hand or manually, whereas today many tests are automated, but you still need someone to interpret that.
All right.
Okay, so the field has definitely changed as medicine and many fields are changing, but yes, it's a needed skill.
Because I was going to ask you that we are in the fourth industrial revolution. So is there a possibility that the field that you are in will also be part of the careers that are replaced by technology?
That's a good question, because I do think it will definitely be affected. Because, as I've said, the nature of those testing platforms. So in the past, you might have done a lot of tests very, very manually. Now you can pop your blood sample into an automated analyzer and it can spit out all the results. But someone needs to still look at those results and to interpret it. But yes, I definitely think there will be changes along the way. I think the profession will always be there. It will just be a bit different.
Wow. Okay, let's say, for example, because I want to understand this, a woman who cannot give birth, for example, how do you solve that situation? Are you able to solve it, since you're so informed about the chromosomes and everything? Are you able to solve a situation that is like that, or do you just manage it?
Okay, so for example, you cannot change your DNA at this stage. I often say if people should not have guilt if they have, for example, a Down syndrome baby, because it's nothing that they did. They did not eat something or drink something or smoke something or do something to create that. It's as involuntary as deciding, I want my baby to be born with blue eyes. You can't choose that.
No, you can't.
It's your genetics that instructs that. So number one, you can't choose it. But there are two types. So in all these conditions, there's the type that is a random event, like I've explained, and then there's the inherited type. So there is a small percentage where mother or father is actually what we call a carrier. So although they are normal, their chromosomes are rearranged.
Okay, so it's possible that...
It is possible.
Wow.
It is possible. And that is why it's very important that when a baby appears clinically to look like a baby with Down syndrome, it's very important that they are fully cytogenetically analyzed, so that the parents know this was a random event against it's an inherited from either partner, because that affects the recurrence risk of that family going forward. So they want to know if they have the trisomy 21, the 3 copies, it's very unlikely that it will happen again. So we call that a low risk, and that mom will be advised to have prenatal testing for her next pregnancy, but it's a low risk against the baby that looks exactly the same, because the outcome is 3 chromosomes, but it's arrived at 3 chromosomes in a different way. They've inherited the rearrangement. So for that couple, to have a baby with a rearrangement again is much higher, because they are carriers, so they can pass it on. So those parents need to then be guided as that they are then high risk for a recurrence, and they should definitely have prenatal testing if they want to know ahead of time.
Wow. So how do you separate your emotions? Because having to tell a patient that this is how things are, and they are all, you know, the emotions, you see all those things. How are you able to stay strong? Because I think doctors or people in your field, they are very strong people. They can tell a person, no, this has happened, and they are like, as if they are not like feeling anything, you know. And I know maybe they are, but they are trained. So how are you able to separate your emotions from a situation?
Okay, so look, as I said, in my day-to-day laboratory work, most of that is done by the pediatrician originally. But through that, as I say, I got involved with the Port Elizabeth Down Syndrome Association in that we started a branch here that could link up with the national branch. And we've got a committee of about 6 members. And most of those members are actually parents of children with Down syndrome, because the best support is someone who's walked the same road.
Yes,
okay.
yes.
So we might tell the mother or share information with medical information, but the day-to-day support, what happens when my child won't eat this? What happens when my child won't do X? A lot of that support, there's nothing better than 2 mothers of a child. So I assist, if I can call it, in the management or the background of that organization to assist that. So PEDSA has grown in that we've got what we call area coordinators. So if a baby is in a family in the northern suburbs, we've got a mom who will make contact in the northern suburbs. What they try and do, it depends on the time. We've had a terrible year with COVID, and so these poor families have not had much support, because what they normally do, they might meet once a month. Maybe they take turns, or they use a church hall, or they use creche facilities, and they just meet and have a cup of tea and chat. They'll have guest speakers to share information, medical information on milestones, development, stimulation, diet. We have a dietitian who can assist with diet. Then we have another lady who does the families with babies born in New Brighton, KwaZulu, Motherwell, that area. Then we have another group which is called Starfish, and Starfish are for the teenagers, say from about the age of 15. It's very often these children don't finish school, as you know, and there's a lack of social life and social etiquette and social norms. And the lady who runs the Starfish group, she herself has a teenager, and they create all sorts of social activities: cake baking, have a bra, hot dogs, dancing, whatever, activities, hobbies. And in that way, those children also make their own little friendship circles. So, of course, to do all of this, one of the drives is awareness, which is why I accepted this chat, because
talk about the awareness.
that is where the awareness comes in. And then the next field is fundraising, because this is not a paid charity. It's purely volunteer work by all the members. As I say, I got involved through my professional day job. Through those parents, I got involved with this. So we do get a minute amount through Lotto, but very little. You know, Lotto is not a definite, and you never quite know when it's going to come through. So fundraising is an important part. And there's a fundraising campaign that we've had annually now for the last 3 years, called Rock Your Socks. And that has been extremely popular.
It's amazing.
Yeah.
Wow. All right. So the government has not yet funded you yet.
The government doesn't really fund support groups. No. The government doesn't really fund support groups. No. Well, indirectly, as I say, we've applied for Lotto. We've been successful twice, but there's gaps in between.
Yeah.
You don't get Lotta every year. You might get it once every 3 years or every 4 years. So it's not that it's sustainable. There are different areas you can try through social development, things like that. But it's all little bits that you need to, it needs to be an ongoing drive.
All right, so how do you manage to do the awareness drive?
Okay, so in various things. So the 21st of March, for example, is World Syndrome Day, which is probably how this came about as awareness. So right through the world, it's linked to the World Health Organization, it's linked to United Nations. There's a link to highlighting these type of conditions worldwide. So they will assist with pamphlets, with talks, just like this. It's to raise awareness in the community. The Rock Your Socks has really been a very fun way because schools have really got involved with this.
Okay,
so the idea is that everybody wears socks, but you can wear different socks. You can wear mismatched socks, colored socks, short socks, long socks, because no one is the same.
Yes.
So that's the message behind it, that everyone is similar in that we all wear socks, but no one is the same. Some have got 46 chromosomes, some have got 47 chromosomes.
Wow.
So some of the schools have really bought into this, which is great, because the kids buy a sticker. It's a R5 sticker, and for that day they come to school wearing funny socks. And the kids make patterns on, they sew on buttons and toys and whatever onto their socks. But at the same time, the teachers use that day to teach the children something about Down syndrome, or not necessarily even just Down syndrome. Teach them something about that not all children are the same. And so that message has been very successful. So we're doing that drive now in PE on the 19th of March. So this is the platform to appeal to businesses, schools, to get involved. We've had businesses take part too. They can do it in any office, same thing. And just by people doing that, it's raising awareness. And you'd actually be amazed how it spreads.
So to someone who is listening now, a business person or anyone of that sort who wants to help you in terms of funding, what information can you give them? Where can they access you?
Okay, so we've got a website and we've got a Facebook page. So the Facebook page is Port Elizabeth Down Syndrome Association, short for PEDSA. So they can just look for that on the Facebook page. I would say that's the easiest way, and the website's linked to that, and they will have all the information there. If they need to contact one of the committee members for forms or for information, or how to have a Rock Your Socks Day, it'll all be on that Facebook page.
Amazing. Okay, one last question. How do people, for example, I don't know if you're also involved in the communities, like the public hospitals. Let's say this parent discovered that the child has Down syndrome. Now, how do they find you, or do you find them? How does it work?
Now, there's no link. There's no link from the actual hospital. Barring that family would have attended or been referred to a genetic clinic, which is the same as any outpatient clinic. It's just what we call a specialist outpatient clinic. The child would have been referred there. The child would have had blood samples taken at that clinic. Those blood samples would have come to a laboratory, and someone like myself would have diagnosed it. The result would go back to the clinic, and that child would be managed. For example, depending on the severity, the child would need to come back, for example, every 3 months. Would have thyroid tests, most importantly have cardiac check. Depending what is found, they would come back every 3 months or every 6 months to manage the severity. It's at that point that there's a gap, because the everyday today support is not necessarily that you need to go to hospital, that there are diet issues, there's stimulation issues, there's speech therapy, there's occupational therapy, physiotherapy, etc. So this is where the support association, like PEDSA, can just assist to direct the families in what is available. Okay. So in that way as well, it's to also put families in touch with each other.
Yes.
And then they often form their own little contact groups. And lastly on that, for example, we organize an annual Christmas party for the children generated from the genetic clinic. The last 2 years we've had a wonderful buy-in from Santa Shoebox, where Santa Shoebox has donated the number of gifts to the number of children we have. So this year, I can actually say a huge thankful to Santa Shoebox. We had 95 boxes of presents, which was huge.
Wow.
Which was very difficult to distribute in COVID.
I can imagine.
But yes, it was done. So as you can hear, it's various support structures that are put in, from the social aspect to medical, to schooling. The schooling is a big problem, because generally speaking, as you know, we have school challenges in this country, and even more so with special needs schooling. There's a huge problem with special needs. There just aren't enough placements in special needs schools. So one of our committee members, her task is just that. She assists the parents in making applications through the Department of Education for special needs placements.
Wow, you are doing great work.
So it's kind of multifaceted.
No, really, I'm praying that the listeners just spread the word on this, so that you can get as much funding as possible, because this is big work, you know, and it's also very important on our societies to have people like you who go out all of their way to do good to humanity, you know, especially without being funded. I also think that our government should do something on this, because this is very important for people to rise and stand for what is right, you know. So thank you so much, ma'am. I don't know if there's anything that you'd like to share, anything you can just feel free to add onto it before we wrap it up.
No, but just thank you for this invitation. Very much thanks to John as well, and for finding me. And I think just to raise awareness, that go onto our Facebook page, especially people who own a creche, who run a creche and nursery school, schools, small businesses, and create a fun day in your office. And at the same time raise awareness and have a Rock Your Socks day, and we can raise funds at the same time.
Amen to that. Thank you so much, Mrs. Caroline. Thank you so much. I am so there's so much that I've learned, you know. You've opened my eyes in so many. You know, sometimes we don't know what is happening around us until we hear such things, you know. So at least now we know that there is something like this, and we're working towards supporting you in every way we know how. So thank you so much once again. May the good Lord richly bless you all and your work. Thank you, ma'am, for being here with us. Thank you. Ladies and gentlemen, thank you.